Hey guys, Dr. Tyler here at Hackbark Chiropractic. Today I wanted to start a series of videos. There's been a lot of questions and a lot of just excitement surrounding the new testing that we're bringing to our office. So we have 3 different types of tests that we're going to be doing. So I'm going to do a video on each type of test and kind of walk you through some of the benefits of what we're going to have to offer here in the next month. So the first one we're going to focus on is inflammation. So the first test, this inflammation test, actually includes vitamin D as well, and we'll get into that as far as why we want to include the vitamin D on that in a little bit. But inflammation is one of those things where it's very sneaky. People can have inflammation that's chronic and it's there for a long time without them feeling huge huge effects, and they really just have minor symptoms that they don't really correlate to inflammation. But we're going to dive into that and show you how they do, in fact, correlate. So some of the big diseases today, many, if not, there's big arguments towards all disease is hugely related to inflammation. So some of the bigger diseases right now that obviously we're more familiar with are rheumatoid arthritis, cancer, heart disease, diabetes, asthma, Alzheimer's. All those diseases are inflammatory diseases. There's many more, but symptoms of chronic inflammation are a little bit more subtle sometimes, where people who don't necessarily have those disease diagnosis could be having symptoms long term that all of a sudden can turn into those things later on down the line. So symptoms of chronic inflammation that can kind of hide from you over time. Many times people will experience things like fatigue, just general chronic fatigue all the time. Mouth sores, chest pain, abdominal pain, fever, rashes, even joint pain. Those are some of the things that people may be experiencing that could be indicators that your body's inflamed chronically. And so when our bodies stay in inflammation, obviously that starts a disease process. Inflammation in the acute sense is actually pretty healthy. It's there to help get damaged tissues out, like if you think about a sprained ankle or something like that, or if you are in a car accident and you sprain and strain ligaments and have internal damage, the inflammatory response goes in to heal the area. But when it stays there long term or it goes internally and it affects our organ systems, that's when it can become dangerous. So instead of treating the symptoms and just covering up the check engine lights with tape, our goal at Hackbark Chiropractic is we want to get to the root cause of the inflammation. So not just trying to get the inflammation down with turmeric. That's a great thing, but just treating the inflammation with turmeric is almost, in the sense, kind of a mechanistic or medical mindset where we're just still treating a symptom and we're never really getting to the root cause. So yes, turmeric is a great thing, but if we're just using it to get inflammation down and never really getting to the root cause of the inflammation, our body will continue to be inflamed over time. So with the inflame test, we're able to see what level of inflammation you actually have, and then from there we're also going to look at your vitamin D levels to see is your vitamin D high, low, somewhere in between, because low vitamin D levels have been shown to be one of those indicators towards inflammation. Obviously vitamin D is one of those things that helps decrease inflammation. So that's the first test. We really want to see those levels as a baseline to see if we need to do further testing, and if so, we'll get into the food sensitivity test and even the DNA testing. So the next 2 videos, stay tuned, be watching for those. We're going to get into a little bit more about what's coming next after we know there is inflammation there. Thanks, guys.